Okay, we're going to get started now. So my name is Andrew Carrick, and I am the Director of Social Determinants of Health for Health Current. And today we're going to be talking about the Social Determinants of Health closed loop referral system. And today's roadshow is going to be specifically for community-based organizations. So here's just a general overview of what we're going to discuss. And I just want to do some quick housekeeping items. You've probably noticed that you're muted as you entered. We ask that you remain muted throughout the presentation. If you have a question at any point in time, feel free to enter it into the chat. We'll have someone monitoring the chat, and they'll be pulling those questions down, and you'll see here on the agenda that at the end, we're going to read those questions out loud and respond to them. In addition to that, if there's any questions that we don't get to due to time, or if we just don't have the specific answer today, we'll be sure to post any additional questions as an FAQ on our website. So let's get started. So first, I want to talk about the program partnerships. So Health Current has teamed up with Access along with 211 Arizona, which is operated by Solari Crisis and Human Services, and then NowPow. We have come together to build a statewide social determinants of health referral system for Arizona, and we thank you all for attending today to learn more about this amazing collaboration. In addition to those key partnerships, we've had over 30 organizations participate in our social determinants of health work group, leading up to selecting NowPow as the platform for this service. And we really want to emphasize that this will be a statewide solution for all Arizonans. You do not need to be enrolled with Access to use this system, and you do not need to be serving members who are on Access to use this system. This can be used for any person in the state of Arizona for making referrals for social determinant needs or healthcare needs. So let's talk about the program genesis. So this referral system really came out of the Access Whole Person Care initiative. So Access launched their Whole Person Care initiative back in November 2019, and they really wanted to focus on the critical importance of addressing social risk factors as a key part of a person's health and well-being. So they connected with community stakeholders and identified three key areas of need. One was transitional housing, particularly leaving correctional facilities or discharge from behavioral health inpatient stay, or people experiencing chronic homelessness. The second area was non-medical transportation with a focus on access to healthy food and employment navigation services. And the third was addressing social isolation. So what are the social determinants of health? Research supports that if we address social determinants of health, we will have a better health outcome. So think about a situation where a person is in need of certain medical care. If they don't have transportation set up to attend that appointment or childcare set up, they may not be able to attend that appointment. In addition, they might have a life-altering situation, such as not a safe place to sleep at night or food to eat. And these factors are critical to a person's health and well-being and will get in the way of their ability to attend to medical needs or healthcare needs. So when we solve for these factors that impact people's social environments, we give people a greater opportunity to succeed in life and live fuller and healthier lives. So what's our purpose in this program? So first, we want to build a bridge to connect healthcare providers and community-based organizations in order to address the social determinant of health needs of our community. We need to create more awareness of the services in the community and streamline communications so that a person can get the help they need when they need it. And with a greater focus on the social determinants of health, we can make it easier for Arizonans to obtain essential social economic services, thus improving their health, well-being, and quality of life, making this that whole person care approach. Using this referral system, community-based organizations can search for physical health and behavioral health resources and make referrals based on a person's needs, or set up to receive referrals from those organizations. And I'm going to talk a little bit about what those referrals are going to will look like. This partnership will foster the rollout of a statewide technology solution that will facilitate the capturing of screening data and codes that relate to social risk factors and tracking referral history and progress. We want to provide organizations with the information and metrics about their services so that they can use data to better understand the needs of the people in their community and the people that they're serving. So I want to highlight our 211 Arizona partnership. So they're operated by Solari Crisis Human Services, and they're a nonprofit organization that offers a continuum of crisis, referral, and data services. And they've been doing this work, connecting individuals and family to vital economic services and making an impact on people's lives. For instance, since relaunching live answering services in March 2020, 211 Arizona has taken over 500,000 calls. They're an incredible partner for our communities, and we're excited to have them as a partner in this program. And here's the proof, a testimonial of their work. Alice has 2 jobs and has been trying to apply for more assistance. 211 helped Alice schedule an interview to obtain her SNAP benefits. And since she was behind in her bills, 211 was able to help Alice catch up on her utility bills, apply for public benefits, and explore job postings to find something that would sustain the safety and well-being of her and her family. Now, the SDOH referral system will be a key tool for 211 Arizona and other organizations helping people like Alice to streamline referrals for these various services to meet the needs of people like Alice and her family, and they will be able to do that all on one system, all in one place. So let's go into some of the features. First, I want to talk about the difference between a shared referral and a closed loop referral, because this is a really important difference. So a shared referral is similar to your current referral, except that the system will track the number of referrals and the referring party. So a person will receive the information via email or text, and then they can show up during business hours at their convenience for that service. And you'll see this in the demo. A shared referral is just an organization identifying that here's where you can go to get this service, the same way that they would hand a piece of paper with that referral information written on it. In this situation, it would send them a text message or email that goes directly to their phone or their email system so that they can have that information at their fingertips. And it also will be in a language of their preference, which I'll talk about a little bit later. Now, a closed referral is different. So a closed referral has to be agreed upon by the referring organization and the service provider. So if you can create that closed loop referral relationship with a provider, say you already have a relationship where where it's going to be beneficial to provide information about whether the referral was accepted and successful. And we're going to show you that in the demo and talk more about that as we go. But then you can provide that feedback on the referral. You can decide how referral feedback is set up. You can set up that closed loop for some services, but not all. And you'll have more outcome data due to more decision points. So because you are providing that feedback on the referral, you'll have more data to look at for each referral. So talk about some of the features at a very high level here. So first is the resource directory. So community organizations can decide what their network will look like and can better manage the flow and success of referrals. So you identify partnerships with referring providers and can set up a closed loop referral. Or you can identify preferred organizations or become a preferred organization and then set up referrals just to be shared. So those 2 different referrals, right? You can set up that closed loop, meaning that when an organization refers to you, you provide some sort of referral feedback identifying it's been accepted and the service has been provided. And that could benefit your organization and the referring provider organization. Or if your setup is not set up to meet that need, you can just do a shared referral so that individuals are just getting your information, but they're getting correct, up-to-date, accurate information for those referrals. And we'll talk more about that as we go. The system really uses the no wrong door approach, which means that you can register a person at any location. So as a community-based organization, if someone comes in, you can register them there at your site. They don't need to go through a healthcare provider to get onboarded onto this, to get a referral sent on the system. So when I think of this no wrong door approach, I really see this as a community effort coming together to decide that a person in need comes before anything else. So we're not directing people to one place or types of places to get the help they need. Rather, we are coming together as a community with a commitment to help that person get directly connected to the services no matter where they show up looking for them. So the system will have screening, the referrals, and alerts and communications. So if you don't currently have any way of doing this, but you would like to, you can screen for social risk factors using this system to identify those individual needs. Or if you don't want to screen for risk factors, you can just select individual needs. If you're just receiving referrals, you'll be receiving referrals for individuals that have already been screened to identify their unique needs and connect them to your service. So you can use the system to communicate with referring parties, people who are referred for services, and for when you're making a referral. All communications and alerts are Next, there will be dashboards, analytics, and outcomes. And one of the biggest benefits of using a system that captures a lot of data is that organizations can use this to aggregate and analyze the data and apply it and use those outcomes to apply for things like grants, identify service gaps, review referral outcomes, view average distance a person travels to use your services, or review average time it takes to respond to a referral. Lastly, there will be a client portal. So individuals will have a separate platform, people that they can access and then do self-referrals for services. So if they're looking up your services, they will be able to get accurate, up-to-date information and then access the services on their own, really driving that self-directed care. And we'll be working to connect that client portal to the referral platform so that when a person does a self-referral, you'll have a view into that information as well on the referral platform. So what are the benefits as a community-based organization? We're going to go through each one of these here. So first, you can keep track of the people you're helping. So consider how many people you help on a given day. Imagine the impact you can have if you know more about the people you see every day. So who is referring them? You may identify key partners that you didn't know you had. For example, you may learn that you have a high volume of referrals coming from a cancer treatment center. And then this information can help inform how you set up your business or your practice if you know that you have a lot of people coming in with certain conditions or certain needs. Another possibility is using the system for record keeping. So healthcare providers have medical records to keep track of their patients. A system like this could be used by a community-based organization to track records and the people accessing services, and there's no cost to using this system. Next, you can communicate with other organizations and referring providers or people. Using the referral platform can decrease the number of phone calls, emails, or faxes you're receiving because you can streamline your communications onto one platform and direct community providers to the communications on the referral platform. At the very least, you can reduce instances of playing phone tag with referring providers. We all have very busy schedules, and by using the referral platform for communications, you can ensure that referring providers have an opportunity to reach out to you at their convenience, and your team can respond at a time that is convenient for them. We can reduce instances where a missed or unanswered phone call causes a delay in helping a person. Plus, you can set up communications with people seeking services to give them an easy way to send messages all on the same platform. You can send alerts when you receive incomplete referrals, or require additional information to ensure that when a person arrives, you have the information you need to offer them support, the support that will best help address their unique individual needs. And you can send those reminder messages to decrease no-shows. You can access reliable and up-to-date resources, a resource directory. So take this opportunity to ensure your services, locations, eligibility, and capacity are all up to date and available to referring providers. This can reduce instances of referrals for services when an organization may not have capacity or a person may not be eligible. If you add services, change your referral criteria, hours of operation, or contact information, or any changes, we will work with you to make those changes in the referral system so providers and others in the community can have access to your most current information when they are making a referral to your agency. You can manage the referral volume, including pausing referrals, so you can identify who you want to have a closed-loop referral relationship with, or just be available for shared referrals. You get to decide what this looks like and how this referral relationship is set up to ensure that you are getting value out of the system. For instance, you can determine through partnerships if you want to be a preferred service provider for certain groups, and if making a referral, you can identify who will show up at the top of the list when looking for certain resources. For instance, you may have a sister organization that you recommend to your population. Now you can identify that organization as a preferred provider and use the system to quickly send or receive a closed-loop referral or shared referral to that organization. Remember, the closed-loop referral will have that referral data and feedback. There will also be language translation services. So one of the challenging factors that we face when we serve communities is ensuring that we can speak the different languages of the people that we're serving. The referral system will not eliminate this challenge. However, it can become a substantial tool to address some of the language barriers. When sending referrals to a person, you can select from over 100 languages to translate the message for the person, and we'll show you this more in detail in the demo. However, Not only can you leverage the language translation services to ensure greater cultural competency and higher accessibility for people to whom English is not their primary language, you can also use this information to learn more about the demographics and cultural needs of the community you serve. And lastly, you can see data on numerous metrics and activities that can be used for grant applications, monthly, quarterly, annual reports, decrease or eliminate the use of spreadsheets and manual processes to save people time and have real-time data at your fingertips when you need it. So here's some activities that you can measure. Not only can you see the closed loop referral, but you will also see how many shared referrals were made. How large is the community you're serving? Do people come from long distances to access your services? You can identify how many referrals led to people showing up and how often we're able to address the person's needs. You can look to see if your staffing patterns and resource availability align with the highest demand. We can get a general sense of the information, but with the referral system, you can apply readily available data to make business decisions. Also, you can have a partner in the community that is making a high number of referrals that you want to reach out to and build a better relationship with. Or maybe a partner agency shows a significant decrease in referrals, and now you can see that decrease and reach out to determine why. Lastly, if you offer multiple services, set some for closed loop and others for shared. Identify what services are used more frequently and by whom. You can decide what types of referral relationships you want to set up for the services you provide, and you can make those decisions using data. So these are the different data points that you can manage the referral feedback. And so you'll see there are several different data points. And this can be set up with your referral partners when you have a closed loop referral partner. So if you have a closed loop referral partnership with an agency, you can determine what type of feedback you want. At each one of these decision points, you can determine whether you're going to capture this data point and what type of information you're going to be capturing. So we can, and we'll show this more in the demo. I don't want to waste too much time walking through here because we'll see that in the demo a bit. The referral feedback. We do want to ensure that the referral system, this does comply with HIPAA, so there will be no additional layers of consent in order to use the system. In order to maintain privacy, a referral can be marked as secure or private, ensuring that only the referring provider and service provider can see the referral detail. But whatever your current relationship is with receiving referrals, that will not change with this platform. The only thing that will change is the way of communicating. Instead of it being phone, email, or fax, it would be using this system. Now I'm just going to do a quick overview of the timeline. So right now, we are in the implementation and planning stage. We'll be doing the early adopter implementation over the summer, which is a pilot process where we're doing just limited use cases. And this will be available to all organizations come the fall of 2021. And lastly, I just want to cover this, is getting signed up is easy. There will be a user agreement that you will need to complete and sign. Then we'll identify the staff that will be accessing the system, and we'll get them set up with an account. And then third, there'll be a minimum of 1 hour of live training to get your staff comfortable with the system, and you'll be ready to go. But I really do want to emphasize that training and support will not end with the sign-up. HealthCurrent and NowPal will be available to support you along the way, and any additional training needs or supports that you need, we will be there to support you and ensure that you're getting the most success out of the system. So from there, I'm going to pass it to Natalie Hammond-Paul and Brittany Lee, who are going to talk a little bit more about NowPal and show you a demo of the system. Natalie?
Thank you, Andrew. Hi, I'm Natalie Hammond-Paul. I'm with the customer success team at NowPal. Go to the next slide. NowPal is a community referral platform for every need and every person. It's actually a play on words, meaning knowledge is power. We are a woman-owned and led company, and as you can see, we're made stronger by our diversity. We're headquartered in Chicago, but we have teams embedded across the country to support partners in all of our geographies, including Arizona. Next slide. The NowPal team will be working closely with the Health Current team to provide support to the closed loop referral initiative in lots of different ways. We have different members of our team who will be working alongside the Health Current team, including myself and a community engagement manager, and we have various experts on staff to support implementation, technical integrations, analytics, and of course the community resource directory. Next slide. So here are some of our faces to go along with the roles that I just mentioned. On the right, you can see Stacy, who's here with us today, who leads the customer success and community engagement team. You'll meet Brittany shortly, who will support community organizations in building out those closed loop referral partnerships. And we're also supported by other team members, including Lisa, Brittany, and Brianna for various aspects of the program. Next slide, please. So NowPal is here to provide a way to really deliver that whole person care, which is precisely aligned with the Whole Person Care Initiative in Arizona. And the goal is really to improve the health and well-being of communities across the state, recognizing that individuals need to have basic needs met in order to live their fullest and healthiest lives. Next slide, please. So to work towards this goal, we're focusing on building trust and driving value. We know that referral quality makes a real difference in someone's ability to access a resource. NowPal focuses on creating that referral alignment and fit so we can make sure we're avoiding referrals to services that a person may not be eligible for. Efficiency is another key aspect of this work. The platform supports a couple of different workflows, creating efficiency in processes and improving communication with partners and the individuals you're serving. And finally, referral success. We're looking towards ensuring that a person receives the services and the care that they need and measuring those referral outcomes along the way. Next slide, please. And with that, I am going to take you through a brief tour of the NowPal system. So I'm logging into, I'm gonna make sure you can see my screen. You see it okay? Great. So I'm logging into the NowPal platform through my browser. You can access it through the browser of your choice, and it's also optimized for mobile devices and tablets in case you have someone who needs to access it on the go. Taking just a moment to sign in here. I'm gonna refresh the page. We'll be brought to the landing page in just a moment. Seems like my internet's a little bit slow today. But it's really helpful to be able to have access to the system on the go. For instance, if you're a food pantry and working with clients who are walking through the door, you're able to find and look for additional services that they may need. Go ahead. Let's try this again. Thanks everyone for your patience. Okay, so we finally landed on the landing page. So right away, you can see the most recent clients we've interacted with. You can tell by the bell icon that I have a new notification from this individual that I'm working with. I can also take a look at all of my notifications up here in the Notifications tab. On the right-hand side, you can see the services that have been most recently added to the resource directory, which is maintained in partnership with Arizona 211. So we're going to jump in right to the services directory. Right away, you can see all of my favorite services. Favorite services are indicated by the orange star. The pink ribbon shows a preferred service. and the green linked icon indicates that this partner is a closed loop referral partner. There are a couple of different ways to search for an organization using the services page. The first is by using the smart search bar, so you can enter the name of a service or organization, and the system will return results within 10 miles of zip code 60615. I can also search for services using the service categories. NowPal's taxonomy has 20 different service categories that break out into over 20 different service types. So I'm going to look for primary care resources for an individual who's getting food at my food pantry. I can see the system returns me 278 different primary care resources in my area. If I want to narrow this list down a bit, I can make the search radius smaller, and I can change the zip code or add any address, county, or neighborhood where my client or the person I'm working with is located. I can further filter using our different filter options here. And I want to pay special attention to the COVID-19 status filter, which shows which organizations may have changed their services due to the pandemic. I can now see that we have 8 results for primary care. And at a glance, you can see information about each primary care service, whether the services are now virtual, the address, hours of operation, and if there are restrictions for that service. Jumping into this organization's profile page, I can see general information about this organization and what their hours of operations are, as well as fees associated, insurance types that they accept, and the languages they serve. These tags here also show some information about accessibility. Each service that this organization provides or program has its own service card that you can see here. We collect service level information because it may differ from organization level information. So you can see the hours of operation for this particular service, which may differ from the hours of operation of the organization. I can also see contact information and that this service accepts Medicaid and that patients need to bring proof of ID and insurance, and that the service is restricted to individuals over 16 years old. As you can imagine, this information is not available through web searching. A third of NowPal is dedicated to building and maintaining our resource directory by calling the service suppliers and confirming the service level detail on a regular basis. The resource directory is maintained in collaboration with Arizona 211 on an ongoing basis to provide you with a robust resource directory that can be used by everyone. The recent date of verification is here. This organization profile can be translated into over 100 different languages. Once you decide that you'd like to share this resource with the person you're working with, you can do so in 3 different ways. You can print this page and you can share it through text message or email using the nudge button, which is NowPal's word for share. You can search for a client name or enter a phone number here. And you can also customize this message. The important part of the message is this hyperlink, which takes the person you're working with to this version of the organization's profile. This V card allows the person you're working with to save this organization's contact information right into their contact list in their phone or email. In addition to this ad hoc workflow and searching for and sharing services with the person I'm working with, I can also take a look at our client management workflow. I can search for a client by name or by ID. And we're able to see the contact information and demographic information for this person on the right-hand side of the screen. You can also change contact consent option here for phone and email. And you can also view the client engagement timeline, which provides a longitudinal view into what screenings were provided for this person, what services were shared, and any other interactions you've had. The Build ERX button is a way to build a list of resources of multiple services to share directly with the person you're working with. I'm going to head into the referral sub-tab so I can take a look at any referrals that I've made for Wendy. I can see here that I referred her to primary care and that the referral was accepted and successful. I'm also able to message the service provider using the bidirectional message functionality here to have that seamless two-way communication. If I'd like to add a new referral, I can do so here. I'm able to see quickly a list of all of the services that receive closed loop referrals indicated by the green linked icon. And I can also look for my favorites. Once I hit refer, I'm able to see the referral form. So this form is pre-populated with Wendy's information and her contact information. I can also see some basic info about the referral partner and a reminder that appointments are preferred. I'm able to attach any documents to this referral form as well to ensure that the service provider has all the information they need to be able to work with this person. Referral partners also have the option of embedding a custom question into the referral form to help make that referral successful. I'm able to add any notes to communicate the individual's preferences. So Wendy is best reached after 5 p.m. because she works before then. And here you'll be able to get verbal consent from the person you're working with that acknowledges that you're going to be sending this information in the referral form over to your referral partner. The other way that I can assess for Wendy's needs is by using a screening. In addition to the prepare screening, NowPal can also host a custom screening. NowPal supports all different types of questions and custom screenings of your choice that can be available in multiple different languages. You'll see here that Wendy's address and information is pulled right in here so that the system can best match resources to meet her needs. We're also able to add additional questions to this screening to support your workflow. Once I'm done with the screening, we can see the different needs that were identified for Wendy, and I'm able to save this screening right into Wendy's profile page. I can then create a list of resources based on Wendy's demographic, geography, and the needs identified in this screening. The system pulls back the 2 resources that are closest in distance to Wendy's location. I'm able to further refine this list by removing resources, adding additional resources, and making comments as well. I'm also able to make a referral right from this list. I can save this list of resources to Wendy's profile, and I'm able to share it through printing, text message, or email. I'd also like to show you how to take a look at the Referrals tab across the individuals that I'm working with. I can see here all the referrals that I've made for different services, and I can also take a look at referrals by client. Here I'm able to, at the end of the day, follow up on any referrals that may still be in progress and send any messages to my referral partners to get an update on the status. And with that, I'm going to hand it over to my colleague Brittany, who will show you a little bit more about what it looks like from the service provider workflow. So Brittany, take it away.
Muted here. All right. Thank you, Natalie. Stop video here, and I'm going to share my screen as well. Give me one moment here. I'm going to sign in here to my web-based account, just like Natalie did. And here I'm signing in just as Natalie did. My screen looks a little bit different. Here I would see all of my recent clients as well. I would come over here to my bar, and I would be able to see all of the referrals that I received. Just as you saw in the presentation earlier, I would have a list here of all of the referrals received. And if you look here, here is Wendy's referral that Natalie sent me earlier for primary care. If I were to press down here on this caret, it would open up the referral, and I would be able to receive Wendy's demographic information. So her telephone number, email address, date of birth, etc. I could click here and view any additional information, any documentation that was added as well. I would see who made the referral, who the referral source was, meaning who was the name of the person who sent it to me. If there were any messages added to this referral, there would be a little orange dot here that would let me know. When the referral was sent, was there a referral note added? You can see here, this is the note that Natalie left. Wendy is best reached after 5 p.m. So now I know that I should try to reach, I should try to reach Wendy after 5 p.m. And so I should try to do that. And my first step would be to know whether or not I can accept this referral. In order to do so, the first thing that I would do is click here under acceptance. Once I click here, it's going to have this pop up for me. Here under acceptance status, I can click this downward arrow, and I can indicate whether I'm accepting the referral, denying it, or waitlisting it. For purposes here, I'm going to accept the referral. Once that happens, another box is going to pop open, and it's going to ask me what is the contact status. For purposes here, we're going to say that I was actually able to contact Wendy. I'm going to open this up, and I'm going to have a few different options. Attempted to contact, contacted, unable to contact, other, contacted. Once I do this, a few other boxes are going to open up. I'm going to be able to add an appointment. I'm going to be able to add a walk-in. I will also be able to say whether or not Wendy declined the service for whatever reason, if she was ineligible for the service, because if you remember earlier, Natalie showed us that sometimes clients come in and they're ineligible due to maybe age, or they didn't bring in some of the necessary things that they needed. We'll also have a box here that says whether or not the service was received and what the service outcome was. Here, I'm going to add an appointment for Wendy. If I click here, the appointment time and date will pop open. I can select her appointment time. I'll say that she's going to come in today. And because she works, I'll say that she's going to come in at 6:30 p.m. And then I can save that. Now, if you see here, the status of the referral has changed. It's now in progress. You can see that I've accepted the referral and it has been contacted. Now let's say some time has gone by and she's actually come in and completed that appointment. I can come back here and click whether or not she attended. Have these options: attended, no-show, canceled and rescheduled, or canceled and did not reschedule. I'm going to click attended, and then whether or not the service was received. Was she able to meet with the provider? Yes or no? Yes, she was. And then service outcome, it was a successful appointment. Once all of this has been filled out, you're then able to close the referral. Once I click close here, you'll get the check mark. And as you see, Wendy has now left your list. There are other ways that you can view all of your different referrals that are listed here as well that I'd like to show you. You can see here that you can view them by client. You can also view them by services. So now all of your case management is in one place, childbirth classes, primary care, etc. You can also view them by the status of the referral. So you have all of your open referrals, new, or based on what milestone they are in their progress as well. Services, do we only want to see case management at this time, or maybe we just want to see primary care? And then as well, by who your closed loop referral partners are. There's also another way that you can view these, and I think this is a good way to view them for CBOs who may do appointments, and it's called our task view. If you come here, you get these different buckets. You get new referrals, upcoming appointments, attendance and outcomes, and you also get your wait list. Here in the new referrals, you can sort by the services again, by your partners, and then you can also sort by the receive date. So newest to oldest, oldest to newest, last name, and by priority. So here we have Jose. We can come here and we can select again, was it accepted? Was it contacted? You can add appointments, etc. Once we did all of that for Jose, he would move down here to the upcoming appointments. Once it's moved down to the upcoming appointments, he would be listed here. You'd be able to send a reminder for the appointment through text or email. You can once again change the language to over 100 different languages or add anything to this that you wanted. So you can type in if you wanted to. Or the cool thing too is you can also send batch reminders, meaning that you can send everyone in this group a reminder if you wanted to at one time, instead of having to send the reminders individually. After appointments are completed, they would come down here to attendance and outcomes. This is where you would come in and say whether or not they attended their appointment and if the service was received and what the service outcome was. And then from there, you would be able to close the referral. And from there, you would also have your wait list if your CBO did wait listing. And you can come here and you would be able to move someone from the wait list if you wanted to do so. So that is how the referral system works. The next thing that I want to show you is your dashboard. This is just a quick glance at your referrals and what's happening for you guys. So you would be able to see how many clients you referred. You would be able to see the referrals you received over the month, how many no-shows you had, how many were actually eligible, what were your referred services that you received for, how many you were able to contact successfully, who are your top referral partners, your response time, the referral receipt of services is here as well. And then one other cool thing that I would like to show you guys here is in your settings. Sometimes you may not be receiving referrals on a daily basis and you don't want to sign into NowPal every single day. So in order to make that easier for you, you would be able to turn on email notifications. And when you do that, that means that you can change the email frequency to where you would either receive a notification that you have a referral for either every referral that comes in or either once per day. So I think this is really, really great for those that do not want to sign into the technology every day, but only when you actually have a referral that signs in. And with that, I'm going to stop sharing. And thank you guys for taking a look at the demo with me.
Thank you, Brittany. Along with that analytics dashboard, there are also a variety of reports that can be pulled that are really helpful in reporting requirements and grant applications as well. There are over 15 on-demand reports in the system that admin users can access at 4 different levels, from the organization to the ecosystem level. The reports show different information about user activity, the most commonly referred to organizations and services, closed loop referral acceptance and success rates, as well as data on the distance individuals are traveling to access different services. These reports are also downloadable in a variety of formats. Next slide, please. So we're really working to achieve that community health impact, and we'll make sure to be able to support the entire population, doing so efficiently in a way that fits right in with your workflows. We'll be building trust by generating high quality referrals to deliver that whole person care. We're really looking forward to supporting you and the Health Current team to improve health and well-being for all individuals across the state. And I'll turn it back to you, Andrew, for some questions.
Thank you, Natalie and Brittany. Just one last quick thing. If you're interested in getting more information, letting us know that you're interested and you want to continue to get updates, you can go to our website here at healthcurrent.org/SDOH. Complete an interest form, and all that does is let us know that you're interested, gives us your information so we can reach out to have additional discussion. And I want to get to the questions, so I'm just going to jump right here. This is my contact information along with Clay Cummings' contact information. And if you have any questions or would like to meet with us, please feel free to reach out. And Clay, let's get to those questions.
Thank you, Andrew. We have a few questions in the chat. The first one, can a single sign-on be established via my electronic health record?
Yes, there is an option to do a single sign-on integration if you have an electronic health record. And all integrations will be free of cost, so there will be no cost from Health Current or NowPow related to an integration, a single sign-on or a bidirectional integration.
Thank you. Are there any healthcare privacy safeguards with this product?
Yes, so as I mentioned in the presentation, if you are making a referral for, say, a substance use disorder service or say domestic violence services, we can set those referrals up. You can check a box that says that this is a private referral, so that only people that will see that information are the referring provider and the provider receiving the referral. In addition to that, the system is not sending clinical data or capturing clinical data, so you're going to follow whatever process you currently have in place. So if you're talking about receiving referrals from providers, whatever relationship you already have in order to receive those referrals, that's not going to change. This system will just be the new modality of doing that. So the provider will be responsible for getting appropriate confidentiality or releases in instances where it's needed, and using the system to make the referral instead of a phone call, email, so on. So yes, that is factored in, and this would follow whatever privacy process you're currently following.
Thank you, Andrew. Can this product push data into my EMR via the Health Information Exchange?
So we will be connecting to the Health Information Exchange with this system, but only for the purposes of matching, to make sure that we're going to use our master person index of the Health Information Exchange to ensure that duplicate records aren't created. But if you are wanting to connect directly into your EMR, you would connect to the NowPow system. So you won't have to pass through the HIE to get to the NowPow system. You'll just connect to the NowPow system.
Thank you. And that's all the questions we have at this time, Andrew.
Oh, okay. Well, if you have any additional questions, feel free to reach out to Clay or I, and you can go to the website and fill out an interest form. and we can provide any additional updates from there. So thank you everyone for joining us today, and we look forward to hearing from you. Have a great day, everyone.